Welcome to our Healthy Thursday conversation, where we put the spotlight on a health issue affecting us, but particularly around this period of COVID-19, we tend to have conversations related to it. Today, we put the spotlight on our children. Many of us have children back at home. We have to go to work. Sometimes we have people taking care of them, but it's not the same when the parent is not around. So we're told that there are incidents being recorded in the hospitals because children are getting injuries in the home, mostly because of lack of thorough supervision. We also have been told of incidents where parents are not confident enough to take their children to the hospital to be taken care of. So cases are being reported rather late. Today, we're talking to the pediatricians. We have one joining us from Kumasi and one in Accra. My guests, Dr. Ajwa Amamo, is a member of the Pediatric Society of Ghana, but she is also a pediatrician at Shimota Hospital. Good morning to you, Doc. Can you say hello to me and my viewers?
Good morning to you and to all the cherished viewers of JoyNews.
Okay, great. Thanks for having you. We also have Dr. Gloria Mponsa-Kodua, who's also a pediatrician at the Tafo Government Hospital in Kumasi and also a member of the Pediatric Society of Ghana. Thank you, Doc, for also joining the conversation.
Hi, Mama V. Good morning to you and good morning to your cherished viewers. Hi, Ajwa.
Hi, Gloria.
Okay, so it's good to have both of you, and it's good to have the perspective from Kumasi and Accra. So can I start with Dr. Amamo on the trends that you've observed?
All right. In the current times which we have, which is the COVID times, they are not normal times. And we have seen a drop. Initially, when the lockdown started, a very drastic drop in children reporting to the OPD. This is because, as you said earlier, parents did not feel safe, and due to the lockdown and the stay at home, which we were encouraging, most people were not bringing their children early enough to hospital. As a result, you are right. We're seeing children who usually come in and need admission most of the time because they've been ill for longer and the illness is a bit more severe because the parents didn't report early enough and then kept trying home remedies instead.
Okay. Can we also have the Kumasi perspective? Dr. Mponsa-Kodua.
Yes, Mama V. It's quite similar. Yes. So the situation is also similar in Kumasi. When the lockdown started, we had a very drastic reduction. But now it started picking up anyway. But then generally, the OPD attendance has reduced, and parents are still worried about coming to the hospital and getting the virus. And so what I've noticed is that they usually go to the pharmacy shops to buy medication for their wards when they are not feeling well. They would rather go there, get the medicine, than come to the hospital. And so we tend to see patients coming late into the illness, the onset of the illness, and they often come with complications too. Sometimes the wrong medication is given, and in addition to the complication of the illness, you also have to deal with the side effects of this wrong medication that was administered. Some also try herbal preparation, which has been with us for a long time. But currently, you see an increase in the number of patients who have come because they've gone to the pharmacy shops and gotten some medication for an illness which they shouldn't have taken that medication for. So yes, attendance has reduced. We are seeing cases late. And in addition to that, we also have to deal with the complications from wrong medications that they've taken.
So, Dr. Amamo, what diseases are being reported? Is there something that is particularly common around this time?
Well, children usually present with upper respiratory tract infections, which is the bulk of what we see at the OPD. That has not changed. However, as I said before, the children that come in now are usually a bit more sick and may need admission. The neonates also, that is the newborns, also present with a lot of jaundice. And we are seeing maybe a slightly higher trend in reportage of home accidents and food poisoning.
Food poisoning?
Well, a slightly higher rate that we would have had in normal times.
Okay. Now that you've introduced the home accident, let's talk about accidents such as?
So there's a very wide range of accidents that are reported. Most that report to our OPD are related to falls, motor vehicle accidents, and then children who are pedestrians and involved in accidents. We have other injuries that also come in as and when.
Okay. But Dr. Amponsa-Kodia, what's wrong with going to the pharmacy and getting something if I feel my child is either hot or coming down with something before I report to the hospital if it gets severe?
Okay, so the problem with that is that, at the hospitals, when a person comes, we examine the person after taking the history, that's listening to the mother talk about what's wrong with the child, what is noticed in the child. We also do an examination. So we look at the child, we examine the child, check the breathing, check the heart rate, feel for any things in the abdomen, which it's not supposed to be there. And then we also do lab investigations. So when you go to the pharmacy shop, you might not get all these things being done for you. And they listen to you and then prescribe medication based on what you say. But when you examine the person, you may find something different. And then when you do the labs too, the diagnosis may actually change. You may have to add a few things or take out a few things. So you don't get that comprehensive assessment in the pharmacy shops as you would in the hospitals. And that's why you may not get the right medication if you go to the pharmacy shops. Usually the pharmacy shops are supposed to be a first aid center. So you have a fever, you quickly go get paracetamol. You have some pain, you quickly go get a pain relief. But if the child is really sick, after that, he has to be brought to the hospital for a very comprehensive assessment and then the right medication prescribed.
Just to continue with you, the home accident that we heard from Dr. Amamo with her observations at the Achimota Hospital, is it the same with you?
Yes. As I speak to you, we even have one on the ward that we are managing. And even last week, we also had a child who had gone to ingest chew a bar of soap, and the parents had tried to induce vomiting, get the child to vomit it out, and she came in with complications. So yes, we are getting patients, children coming in with home accidents. And we also have, it's the rainy season, so we are also getting cases of malaria, a surge in the cases of malaria we are having, and also the common colds and, other pneumonia and other respiratory diseases. But we are getting home accidents as well.
Okay. Dr. Mamo, you understand the fears that parents have around this time. You don't want to quickly rush your child to the hospital. We know that the cases are increasing. We're living in the new normal. We're recording a lot more COVID-19 cases. And sometimes you are not very sure if the mask the child is wearing is safe enough, if it's protective enough. And we're told also children under a certain age should not even wear masks at all. So if you're taking your child outside the home, you're worried. And so you're not rushing to take them to the OPD.
I think what you are saying is true, but largely I would like to allay parents' fears. This is because hospitals are aware that our environment attracts a lot of sick people who may include COVID patients. Because of this, the Ghana Health Service has put in a lot of policies. The hospitals, my hospital in particular, has put in a lot of policies to help protect children and other patients who come to the hospital. The first is having a common entry, and now almost every hospital is screening everyone with a temperature and a questionnaire before the patient is even allowed in. And based on your symptoms, you may be asked to join a separate queue if we think you may have the disease, so that you don't even mix with the OPD. At the OPD as well, there's been a lot of spacing done so that some chairs are crossed out, and we're trying to socially distance patients. We're also trying to rotate such that at any point in time, the numbers that are there, the turnover, we try to work fast so that people can be seen faster, and then there are no crowds as much as possible. So a lot is being done. And then in the hospital, the policy is no mask, no entry, which is even safer for us because most other places, you don't even see people wearing the mask anymore, which is worrying. But in the hospital, everyone, child, especially above 2 years, has to wear a mask. And in the consulting room, it's also done. So there are a lot of measures that are being put in place. And we want to reassure parents that you will not be putting your life or your child's life at excessive risk if you decide to bring the child to hospital.
Dr. Amponsa-Kodia, I also heard yesterday that there are some parents who are also, especially the children with either asthma or sickle cells, those who need the regular periodic checks, are also not showing up. What are you recording? Dr. Amponsa-Kodia, if you heard the question.
Yes, can you hear me now?
Yes, I can hear you. I hope you heard me.
Yes, okay. I did. So it's true. We are getting a reduction in the number of these cases too. So what we call the chronic cases that need regular follow-up, the sickle cell, asthma, epilepsy, and then other developmental disorders. So yes, generally there's a reduction in the trend, and those with chronic cases who need regular checkups and need their routine medication, the attendance of these people in the hospitals have also gone down. And I think it's likely due to the fear of contracting the coronavirus disease, the COVID-19. So yes, attendance has gone down.
I'll let you two help us with some tips. If you have a child with asthma, if you have a child with sickle cells, and then how do we even prevent those accidents that you talked about, knowing that children are home, sometimes by themselves. But I want to invite our viewers, if you're watching, you have questions that you want to ask us. Our concentration purely is on our children. So if you've got questions, kindly give me a call on 030221169102, 030221169102. Call me now. Let our doctors help you out with your questions and then the comments that you may have. So straight away, Dr. Mamu, let's talk about how do we prevent some of the accidents that we're recording these days?
So there's been a lot of research into this in more developed countries. And over here with the motor vehicle accidents, for that, it's been shown that children, especially children even up to 8 years, have to have a seat belt or some form of a car seat. So if you have an infant less than 1 year, the child needs to be in a car seat and needs to be at the back. No child should be allowed to sit in the front if they are under 13 years old, because it's been shown that the airbags do not protect children because they are designed for adults. Apart from the use of the car seats, any child under 5 is prone to driveway accidents. So a parent is going out of the driveway and then the child kind of crosses at the back and nobody sees the child and the child gets run over. If you have such a child, then the child should be kept indoors whenever the car is around or about to move. The children should be kept indoors. Also, children who are under 10 years may not always be able to negotiate through heavy traffic on their own. So if you are a parent of such a child, you should let the child know that you don't cross the road on your own. You need to get someone to assist you. And you should take that primary responsibility up as much as possible as a parent to ensure that the child gets to where they're going safely and comes back safe. It's also very important to get a safe play area for kids because now kids are at home 24/7 and they find all kinds of places to play which can lead them make them prone to accidents. For instance, children should not be allowed in the kitchen, and the kitchen should not be the play area for children.
Okay. All right, great. I have some follow-up questions that I would ask you, but just hang in there for me. Isaac is joining us from Labadi. Isaac, good morning. Thanks for calling.
Yeah, thank you very much and good morning.
Great. Good morning. Let's hear you.
Yes, I want to find out whether, especially with children, do we have a special guidelines for children in wearing face masks? And when children are immunized, are they protected from COVID or chickenpox?
Okay. All right, Isaac, thanks for your call. Doctors, who will take Isaac's question?
Okay, let me help.
Okay.
Isaac, thank you for your question. So usually children who cannot talk well and tell if there's a problem or if they can't breathe well should not be in maths. So for instance, children who are usually less than 4, they may not be able to speak well. And if they are suffocating whilst wearing the mask, if they are not getting enough air, they may not be able to articulate it properly. And so we don't recommend children less than 4 to be in masks. And even those who are older than 4, but for some reason, maybe developmental delay and other neuro disabilities, problems affecting the brain development, like cerebral palsy and other things. So they are older children, but may not still be able to speak well. And so such children, we don't recommend the wearing of masks for. And then when it comes to vaccination, the vaccination centers are also safe because they are instituting the same protocols. The nurses are wearing masks. The parents are also told to wear masks. It's the children being vaccinated who usually are not in masks because they are too young to wear masks. But we also ensure that there is social or physical distancing there so that the children are also protected. And we do have vaccines for various diseases, but chickenpox is not one of the vaccines that are in the expanded program of immunization that we have in Ghana. So chickenpox is not one of them, but we have other diseases that children are vaccinated against, and the vaccination centers are also safe.
Okay. Atika is in Salaga. Let's hear from Atika. Good morning.
Good morning, madam.
Yes, ma'am. Thank you. Let's hear you.
I have a problem with my children, all of them. They are about 4.
Yeah.
When they are sleeping in the night, the person will just wake up and be complaining of the legs are paining, and the person will be crying the whole night. And I want to find out whether you will help me to detect the cause of.
Okay, can we have you do the narration again? You said you have a 4-year-old, correct?
No, the children, they are about 4 with me.
You have about 4 children?
Children, and all of them are complaining the same sickness.
Okay, which is, what are the signs again, the symptoms?
There will be holding their legs, wailing that is the bones are paining them.
Okay.
In different times.
Okay. Is there a time when they complain? Is it at night?
At night.
Okay. All right. Well, thanks for the question. Dr. Mamo, can you help us?
Yes, I just wanted to add to the previous one. The chickenpox vaccine is actually available as a private vaccine. So for those who can afford, because you need to pay for it, your child can be protected. Aside that, for this mother who has 4 children complaining of this, I would advise her to come to the hospital. Sometimes some of these pain issues may even be due to chronic conditions like sickle cell, but the child needs an evaluation, especially if it has persisted. So, as Dr. Kodria said, the child needs to go to the doctor, be inspected, have an examination done, and then if labs are needed, and then if she needs to be reassured, it would be a very simple procedure.
Okay, all right, great. There's a question that I wanted to ask on the wearing of mask when you were talking about it, but I'm sure it will just come up again. But I remember now. Is it, which of the mask would you recommend? Is it the fabric, the local fabric one that are sewn, or the surgical one? Which one should we give to children?
All right. Okay, so I can start.
So both are actually okay. They are you can breathe through them easily, and so it all comes to availability. With the cloth mask, you get to wash and reuse them. So if that's convenient for you, you can go ahead and have that one. And for the surgical mask, you know that if it's soiled, you have to throw it away. But both are actually safe for the children.
Dr. Mamo?
Yeah, the cloth mask is also good because sometimes they fit better for the kids. But for the surgical mask, what I've noticed is that most people, Dr. Kodria said it, they tend to reuse. I put it down today and tomorrow I want to put the same thing on the child. That's not how it's done. And then the fit for the surgical mask, especially in younger children, may not be so good. So you may need to adjust it to make sure that it covers the face very well when you put it on the child.
Okay, let's go to the phone lines. Obed is in Dorwenya. Good morning, Obed.
Good morning.
Yes, thank you for calling. Let's hear you.
I want to make a follow-up on the chickenpox vaccine. Yeah, I want to know at what age should the person be vaccinated? And as you said, what are some of the possible shops or facilities we can go and access those facilities?
Okay, all right. Thanks, Obed. Dr. Mamo?
Okay, so usually the chickenpox vaccine, I think after 2, you can give it. After 2, it can be given after 2 years of age. There are a lot of private places, but I'm not on air to advertise any one of them. So talk to your doctor and you'll be directed to the right places to go. But there are places around, especially in Accra, where you can get it.
Moses is in Keta. He joins us on the phone. Moses, good morning.
Hello, good morning. Mama,
Alfo, you're on air. Let's hear you. Marco, you're more
Okay, what's your doing, Yamandia?
Okay, Moses, we're listening.
Yeah, God Himself knows how to secure the vulnerable ones. So the children are having a certain kind of very strong immune system that will help them naturally to overcome any sort of infection. That is why they don't need any kind of face masks. So, however, that doesn't mean that they should go back to school. They should stay at home. They have God has prepared a very natural immune system for them. Thank you.
Okay, well, thank you, Moses. I think you're passionate about a certain cause, and you decided to call and share. We appreciate it. Thanks a lot. That's Moses calling from Keta. But on the back of what Moses just asked, let's talk about the immune system of children and what we can do to boost it. I've heard comments like children can better fight COVID-19. I don't know how true that is because they have a stronger immune system. Can you please spend a bit of time helping us understand this? Doctors? Dr. Amponsah-Cody, I'll start with you.
All right, sure. So, yes, it's true. What we've noticed is that children tend to get a milder form.
Unfortunately, we seem to having some breaks in that. So let me just go to Dr. Mamo. We'll come back to you, Dr. Amponsah-Cody. Dr. Mamo, can you help us?
Hello?
Yes, Doc, we can hear you.
Yes, studies currently show that most children have very mild disease when it comes to the COVID. However, this does not mean that the child should not be protected. Children are a vulnerable group, which is recognized in our society, and they need to be protected. However, there have also been cases, even in our hospitals, of children who have suffered severe neurologic impairment or respiratory complications from COVID, though this is on the lesser side. So the children, yes, have an immune response that usually produces a mild disease with COVID, but there are children who have reported severe illness as well.
Okay. Let's go back to the phone lines. Akpene is in the Sojaman in the Eastern region. Akpene, good morning. You're on air.
Good morning, Mama. We are fine.
Maraku, emo phone half one.
No, sir.
Okay. Let's hear you. I would appreciate it if you speak the English so that our doctors can hear from you. Go ahead. I'll do the translation.
Okay, I translate now.
You must see.
My symptoms I don't have another COVID. My dinner 50 years. I'm a pa. Nyetana mali say nye temperature is avanja. Kono mali ha 50 years pona de ever. My son after for last week. Then you start your video less than 2 months. Eko me vovo me maybe na ma va test positive day the via the leke.
Okay. Ka de via phone ni ho.
Oh, less than 2 months.
Okay. Okay. All right, Akpene, Akwesia. Okay, doctors, let me help with the translation. Akpene from Esojaman is complaining. So she thinks she may have some symptoms of COVID. For instance, sweating and high temperature at night. Her fear, though, is if she tests positive, then it's going to affect her 2-month-old baby. Dr. Amponsah-Cody or Dr. Mamo,
yes.
any of you?
I hope the line is
Yes, it is. Now. It is. The line is clear. Please go ahead.
And I'm picking a few other words from you, free of charge. Thank you for that. So, yes, she has fever, which could be a sign of COVID, but could also be the sign of a number of other diseases. So it's better for her to get tested. And there's a phone line, the 112 that she can call and then get advice on what to do from. But if that also doesn't work, if she calls and she doesn't get any response, she can go to the hospital, but making sure that she has her mask on and then observe the physical distancing and tell those at the front desk that she has fever and she has symptoms that she suspects might be COVID. Those there would know what to do with her. But whatever be the case, it's important that she gets the assessment done and the treatment started early to avoid any complications. And as for the 2-month-old, even if that child, if the mother has COVID and so makes that child exposed or even infected, there are still things to do for that 2-month-old. It's better for her to go to the hospital, be assessed, and the treatment started early. Early treatment helps to improve the outcome. And there's so much that can be done for this 2-month-old. So she shouldn't be afraid to have the assessments done at the hospital.
Thank you, Doc. Dr. Mamo, so will she still breastfeed? I mean, should she still continue doing the things that she does, knowing that she's showing symptoms?
WHO actually recommends that children or babies born to COVID-positive mothers can be breastfed if the mother is in such a position to do so. It's only if the mother is very unwell that she cannot breastfeed that breastfeeding is stopped at that point. So breastfeeding, yes, can continue. The other thing is, as Dr. Mpunsakudria said, it's better for her to get to her physician, get assessed, and then whatever treatment may be assessed for her and for her child can be done quickly, because we have recorded cases of COVID in even neonates, a few though. So it's better to get reported. Early treatment actually helps. It's very, you get better outcomes when treatment is done early.
Okay, all right. Let's go to Majid. Majid is in Kentampo, and then I'll come back. I'll come to you, Kwabena, calling from Spintex. Majid, thank you for holding. Good morning. Yes, sir. Let's hear you.
Okay. When we talk of children, hello.
Majid, we can hear you. Go ahead.
Children are very prone to a lot of diseases, and then COVID-19 is of no exception. Well, I remember in Italy, there was an instance where a 17-day-old baby was contracted with COVID-19. I don't know if you could remember that instance. And then if we expose our children to the environment when COVID exists, I doubt if they will be able to follow all the outlined protocols.
Okay.
I think this is my take. So children should be well taken care of.
Okay.
And then once they are the vulnerable ones.
Okay. All right, Majid. Thank you very much, Majid from Kintampo, for your comment. Kwabena from Spintex, unfortunately, we lost you. Kindly give us a call back. I think we have just some time to still spend on this conversation. I have some follow-up questions. So I give my children zinc and vitamin C. Now, yesterday I was thinking, so for how long can I do that? And this is talking about boosting the child's immune system. What should you give the child to boost their system? Dr. Kodia.
Okay, so children should get the right nutrition, COVID or no COVID, because there are also other which should still be around even after COVID.
Unfortunately, the network is going bad again. The connection is going bad. But let me speak to Kwesi. I'll come back to you, Dr. Mpunsakudria, for you to conclude on that. Kwesi Afol is joining us on the phone. Good morning, Kwesi, from Kumasi. Hello, Kwesi.
Good morning, madam.
Good morning, sir. You're on air. Let's hear you.
I have a question. I have a question.
Okay.
Whether you can give me chance.
Okay, please go ahead.
Okay. If the woman has a baby, the woman has a baby and you got an what do you call it, a COVID, the child can and if he breastfeed the baby, can the baby get a infection?
Okay, that's your question.
Yes.
Okay, it's actually been answered already. The answer was no. But let's get some more education on that. So thank you for asking this question. Dr. Mamo, I think you made a comment on this. The follow-up question that I had was, should the mother be wearing mask all the time when they are breastfeeding?
Yes, they would have to be masked because the mother's symptoms will definitely have a cough, which can transmit droplets to the baby. So the mother would have to be masked when breastfeeding, but she can breastfeed.
I am just thinking about how practical this would be. You have a baby, you are the mother, and you're taking care of the child. Can you be conscious of the situation and wear mask all the time?
Not all the time, But when you are breastfeeding, if you have symptoms like cough, yes, you should be during the breastfeeding. With the other times, we know there's hand washing. It takes practice, even for us as it takes practice, it takes conscientiousness, but you can do it. You can do it because in that way you protect yourself and you protect your baby.
Okay. All right. So Uncle Kwesi, that's your answer there. But the woman must wear mask. Let's talk to Saibu in Tamale, and then I'll come to you, Dr. Amponsah-Kodia. Saibu from Tamale. Good morning.
Good morning.
Yes, sir. You're on air.
Okay. My contribution is that we should allow the rural children to go to school.
Oh, you want children to go to school? Okay. I hear you. Unfortunately, because let's hear you.
Go to the rural communities in the north here in particular. The children, the whole community, the children are congregating at one place and they are playing together. And if they are in school, teachers will be there to guide them to observe the protocols and other things. But at home, parents go to farm and leave them alone. And I think that if they are in school and they are being taught and also be guided, it's better than they being in the house and playing all by themselves.
Okay.
So that's my contribution.
Oh, and we appreciate it. Thank you very much. So, Dr. Amponsah-Kodia, let's talk about, we'll come to the playgrounds, but let's talk about what you were commenting on, boosting the immune system of a child. You said nutrition.
Yes. So let me quickly add that with a breastfeeding mother, she should also try to be in a mask anytime she's within like 2 meters, within 2 meters, when he's close to the child, he has to be in a mask. So even though it's uncomfortable wearing the mask, Mama B, you know that we are not in normal times, and so we must try to do as much as possible to protect ourselves and our babies.
Yeah.
So yes, while breastfeeding, anytime he's close to the child, you must also be in a mask. And as Dr. Mamu said, the hand washing.
Okay. Let me take the phone. Doc, let me take the phone calls and I'll come to you. I've got Kojo Ahen. Kojo Ahen is in Takoradi. Kojo, good morning.
Good morning.
Yes, sir. You're on air.
Please, I want to ask a question that I heard one of the doctors say it's a must for a parent to wear nose masks when breastfeeding her children. So I want to ask, what if the person has a sweat on the body and the child touches the body? Will the child be infected with the coronavirus?
That's a very good question. Well, thank you, Kojo. Let's go to Kwamina. Kwamina from Spintex. Thanks for calling back after we lost you earlier.
Hello.
Yes, hi, Kwamina. Go ahead, you're on air.
Yeah, I just want to add my voice to the program. We've seen that since the COVID-19 came, all the rules, the rules that was rolled out for us, keeping distance and etc., was meant for adults, and children were left out. For instance, if you are breastfeeding your baby, you were told not to shake hands. But if you are putting your breast into the mouth of your baby, the education was not given as to how to handle it, because it is also, we believe that when you put the breast into the mouth of your baby, it's possible if there's the virus is on around the breast, you can pass it on to the baby. You see, but those education were not given. So I want to advise that they should intensify the education for children, safety, so that they also they are also part of the society.
Okay, we really appreciate your contribution. Thank you. Let me go to Rim. Rim is in Kenya, say in the Ahafu region. Perhaps our last call. Rim, good morning.
Good morning.
Yes, sir. Let's hear you.
Please, the someone called in initially asking of how to boost the children's immune system in terms of times like this. But please, you early on made a statement that you give your children vitamin C, then zinc tablet. How advisable is that? Should you continue giving them those drugs, knowing that, because one thing I've realized is every drug comes with a side effect. How long can they continue taking those drugs, or is it even advisable for them to continuously taking those drugs?
Okay, yeah.
So I wanted to be clear on
well, I also have a personal question like that. So thanks for asking. I'll get the doctors to respond. I think our very last call is Genia is in Techiman. Genia, good morning.
Okay.
Hello, Genia, you're on air.
Yeah. Please, my question is, I heard people saying that they should allow the children to go back to school. And my question is, the children come from different homes to mingle with other children in the school. In case they contract the virus, what is the probability that they will not send it back to their parents after school to infect other people in the community? Because they are coming from different homes, different communities together. Okay.
All right, Junior, thank you very much for your comments. That was an observation that was made, and I thought it was peculiar to the environment, but thank you very much for adding your voice. Doctors, let's talk about the concerns raised by Kojo Ahen from Takra. They will come to Kwamene's question and then Rim, which was the same as the question that I asked. So a mother breastfeeding, there are issues with that. Let's address the concerns that have come up. Dr. Cody, I think you were attempting, I was starting the boosting, the immune booster question with you, but let's hold on to that and let's address the issues that have come up.
Breastfeeding, okay. So with that breastfeeding, a lot of studies have been done, and they have noticed that, they've noticed that the virus is not in breast milk. And so I think we just have to educate people more to allay their fears. But as far as the studies that have been done are concerned, the virus is not in the breast milk of the mother, an affected mother. And so an affected mother can still go ahead and breastfeed the child, and the child will not get the COVID-19. It's as you sneeze, and then it gets into contact with a child's mouth or nose or eyes. That is
Unfortunately, technology is not helping with a good flow, but I can come to you, Dr. Amamu, so you can continue.
Okay, so I think Dr. Kudia has said everything. With the breastfeeding, the way it could also transmit if the hands are not
roots of infection. And so as when you're breastfeeding,
Dr. Amponsa-Kodia, can you hear me, please? Hello, Dr. Amponsa-Kodia. Okay, so the issue is we don't have a great connection right now. It's freezing on us. Dr. Amponsa-Kodia, please, can you hear me? Dr. Amamo, can you hear me, please?
Yes.
Okay, Dr. Amamo, let's go with you. The network was still bad when you started, so please begin again for us.
Okay, so Dr. Amponsa-Kodia said it all. It's not found in breast milk. The thing is, if your hands are contaminated, you could transmit it onto the breast. So you just wash your hands with soap and water before breastfeeding. And that's something you consciously have to do to reduce the risk.
But you know, Kamna from Spintex also raised the issue of the body fluids.
So sweat, and I don't have that data currently. It's not one of the listed ones that I'm aware of, but I think if Dr. Amponsa-Kodia would add something to it.
Okay, sure. Dr. Ambosakodia, hopefully we are not
Yeah.
freezing. Aha, we can hear you now.
Okay, good. So it has not been found in sweat yet. So there should not be any fear that the child will touch the mother's sweat and then will get infected. Having said that, it's still a new virus. It keeps changing. We should observe all the protocols, but don't say that because I'm sweating, I will not breastfeed my child.
Okay.
Currently, there are no studies suggesting that the virus has been found in sweat.
So how do you generally treat the breasts? How do you handle the breasts?
So you wash your hands before you breastfeed the child. And we usually recommend the child sucking from the breast. If for some reason the child cannot suck from the breast and you have to express into a cup, a clean cup, you can do so and then use a spoon to take the breast milk and then feed the child with it. So this is in situations where the mothers are so sick and maybe they cannot breastfeed the child, directly. But you can express the breast milk and then have somebody also breastfeed the child. But the protocols must be observed. The hands must be washed. The person who is breastfeeding or feeding the child with the express breast milk must also be in mask to prevent exposure to the mother's, virus.
Okay.
But the child can suck from the breast directly or be spoon-fed from an express breast milk.
Okay. All right. We have to wrap up. So let's end with the question from Rim and the one that I also raised about boosting the immune system. I think, Dr. Kodia, you talked about the nutrition, but can we talk about the medicines that we're giving them? Because I give vitamin C and zinc, but I was just wondering,
Yes.
Is that safe? For how long can I continue to do that?
So vitamin C, zinc, they are immune boosters. They are vitamins and minerals that are required, the body needs. We get them in food. You can also supplement them, the dietary quantities with the drugs. So you can give zinc, you can give vitamin C. Even after COVID, it can still be given. There are children who are put on zinc with some other minerals and vitamins for, as long as they live. The sickle cell patients, those with other chronic diseases, just to boost their immunity. So children can be put on zinc. You can give 10 milligrams or 20 milligrams a day. That's okay. The vitamin C too, 50 milligrams or 100 milligrams a day. That can be given. Or you can even take an orange a day. That's also fine. So zinc, hello, can you hear me?
Yes, we can hear you.
Zinc, vitamin C are safe. You can give to the children.
Okay. All right.
Hello.
Yes, we had that, Doc. Thank you. But Dr. Mamu, just on the back of that, are there side effects like Rim was raising? Are there known side effects?
There are known side effects to vitamin C overdose, but then you really have to go over the top to get that. And that means that for the child involved, you need to consult with your doctor and get an appropriate dose for the child so that you don't go into overdose and side effects, because the various drugs, the zinc formulation, for instance, it has different dosages, and some for adults, some for kids. So talk to your doctor, get a dose that is good for the child, and then we can move from there. But the best is the nutrition.
Okay.
The fruits, the vegetables, they contain a lot as well that can help a child.
Okay. I asked that because there are some of the children, and I've got two boys. One of them will simply not eat. I mean, it's not regular. So once you want to boost the immune system, you want to have the vitamin C and the zinc on the side. Yeah, exactly.
Just be mindful of the doses.
Okay, sure. Thank you for the advice. But doctors, thank you so much for helping us with this conversation today. Thank you for your patience and for taking all the questions and answering them as well. We're very grateful.
All right. Thank you too.
All right. So our doctors on call this morning, Dr. Gloria Amponsah-Kodia, pediatrician, Tafo Government Hospital in Kumasi. And from Accra, Dr. Ajwa Amamo, who is also a pediatrician at the Achimota Hospital. They are both members of the Pediatric Society of Ghana. And we thank the society for making them available to help us with this conversation. That's our Healthy Thursday conversation. Please stick to the advice that the doctors have given.